Assalamu alaikum. This is Sayyida Urmi Afzal. My roll number is BP1650233 and the topic of my presentation is Lamivudine. So what is Lamivudine? Lamivudine is an antiretroviral drug. It's commonly called 3TC. It is commonly used to treat HIV AIDS and it's usually effective against both of the HIV 1 and HIV 2, and it's also effective against hepatitis B when other treatments are not possible. It belongs to the class of drug that is nucleoside reverse transcriptase (NRTIs). So the mechanism of action of this drug is as it disrupts the viral DNA synthesis. Lamivudine must be converted intracellularly to its triphosphate form, which then competes with the cytosine triphosphate for incorporation to viral DNA strand. This ceases the replication of DNA. So the rational use of this drug as lamivudine oral tablet is used to treat human immunodeficiency virus, that is HIV, and also effective against chronic hepatitis B. It doesn't help in cure diseases. Instead, it slows the progression of the virus as it suppresses the viral uh, suppress the replication of virus. It causes drug resistance when used by itself, so it must be used in combination with at least two other antiretroviral drugs to control HIV. So the irrational use is this medication should not be used if you have any medical condition. Before using this medicine, consult your doctor or pharmacist, like if you have a pancreatitis especially. So elderly people are at a great risk of using this drug due to decreased functioning of kidney as they grow older. This medication has not shown prevent the passing of hepatitis B from mother to infant. So the liquid preparation of lamivudine contains sucrose. So diabetic patient should monitor their sugar level, or they must have their HbA1c monitoring. So the adverse effect of this drug is pancreatitis in children's, weakness, fatigue, peripheral neuropathy, aplastic anemia, Stevens-Jones syndrome. So Stevens-Jones syndrome is a serious disorder of skin and mucous membrane, hepatic decompensations, headache, and diarrhea. So, toxicity related to this is well tolerated with the mild toxicities as compared to the other NRTIs. If overdose this medication occur, the supportive care is required. And dialysis is not a reliable treatment for this, as the several case reports were actually about potential neuropathy like acute renal failure dose. So it comes under an oral tablet and oral solution form. So strengths are given like 150 milligram, 300 milligram for adults or above 18. So 300 milligram each day. This amount can be given as 150 milligram twice a day or 300 milligram once a day. For children, it's based on their weight, like 4 milligram per kg twice per day or 8 milligram per kg once daily. So different interactions are there. Do not take the medication with the other drug, including those that treats HIV infection. Sorbitol may interact with this drug. So sorbitol is sugar alcohol present in fruits and plants. uh, Emtricitabine is similar to lamivudine. It also treats HIV and should not be taken with this medication. It has their own side effect, like they both may interact with each other. Brands available, so common brand is Epiver, and they comes under Lamizid, that is 150 milligram, and their prices are mentioned. Zephyx 100 milligram, and the alternative for these are for hepatitis B. Due to the viral resistance of lamivudine, we can also use Adifovir and Anticavir. So Adifovir plus lamivudine is effective alternative for tenofovir alternative, and of tenofovir plus lamivudine is a long-term treatment for HIV and HBV co-infected patients. So case study is given, that is a 35 years old male is previously suffering from chronic HBV infection, that is viral hepatitis B. infection. He has been complaining about back pain and fatigue. His blood pressure is 130 by 85. Hemoglobin is 14 gram per deciliter. Weight is 65 kg. He also complains about dark pill urine. Been already diagnosed with chronic HPV. His partner is HIV positive and already on an antiretroviral therapy, and load was undetectable in past few years, but now CD4 count is dropped by 400 per cubic millimeter, and patient also complain about fever and chills for past few days. So the subjective is there, like gender is male, age is 35, weight is 65 kilogram, complaints fever, chills, pale urine, chronic HPV, and the history is related to chronic HPV infection. Objective is there, like BP is 130 by 85, body temperature is 103 Fahrenheit, and lab reports are HP 14 gram per deciliter, CD4 count is 400. uh, and sign and symptoms are patient has been complaining about fever, chills, pale urine, and back edges. Also, he has history of chronic HPV. Assessment is related to patient has been, as patient has been complaining about fever and chills with the back edges. He already has a history of chronic HPV. Due to this, urine turned to pale color. His partner is HIV positive. He didn't show any signs of HIV in past few years, but now showing symptoms of HIV because CD4 count is reduced to 400. The normal range of CD4 is 500 to 1600, and the CD4 shows the robustness of immune system. So he probably suspected for HIV. The plan is, since CD4 count indicate the patient becomes suspected for HIV, making immune system weaker. So the low level indicate advanced stage of infection. So patient already have a history of HPV infection, as complain about fever and edges. So for this, lamivudine comes under brand name of Apiver is suggested, as it works for both like HPV and HIV. It inhibits the RNA dependent DNA polymerase. So dose is suggested 150 milligram per oral twice a day. Here is references. Thank you so much.